Hello, everyone. Welcome to another week's episode of Reconnecting the Dots, brought to you by Abdurrahman. Once again, I want to empower and help you to become the best version of yourself through this podcast, and I hope it benefits you. So take a listen to this week's episode and let me know what you think. Assalamu alaikum, Dr. Falake.
Walaikum salam wa rahmatullahi wa barakatuh.
Welcome to Reconnecting the Dots podcast, and thank you for accepting to be my guest on the show. It's actually the first episode on the health and wellness segment, and you're being my first guest for this segment actually on the show. So I'm going to briefly talk about, a synopsis about you, and then you'll be able to tell a little more about yourself, afterwards. So Dr. Falake is she's an infectious disease physician, and she will be educating us on the impact of long-term stress on the body, which is actually the topic we're going to be discussing today on the show. And so I will now delve into the topic for the day. So, but before then, Doctor, can you tell us a little bit about yourself, and listeners can actually get to at least know about you?
Thank you for having me and for inviting me to speak on your podcast. My name is Falake Lawal. It's my last name. And like you rightly mentioned, I'm an infectious disease physician. I Nigerian by origin. I don't know what else to say. I schooled in Nigeria. I did my medical school in Nigeria, and I moved to the US to do my residency, which I did in Baltimore, Maryland. And then I did my infectious disease fellowship clinical training in Georgia. Yeah.
Okay. So the topic for the day, honestly, it's about the impact of long-term stress, and we all know there's a whole lot of chaos going on in the world. Specifically, America also has its own, different kind of issues, and of course, all of these different kind of issues trickle down to things, of course, that actually affects a lot of people. And of course, you have people who are aware about things going on around them. You have people who do not even understand what is happening, but they just they don't even know it's stress, and the truth is there's a whole bunch of things, we never know. So what is stress, and if you can please just, educate us about what stress is all about, and well, let's take it from here.
I would say, stress is kind of something we throw around somewhat loosely. Okay. Definition can kind of be subjective, but generally I think it's just a situation of, it's a feeling, because again, what constitutes stress for each person is different, and a myriad of things can be felt or be effect of stress. So it's basically, it's a feeling where you have like physical or emotional tension, right, or an overdrive of your systems, either biological, psychological. Also, we can also call it somewhere where you have an imbalance, right, of your emotional, psychological, or physiological / biochemical feeling or state. Right. So it's Okay.
So how then do we align this? Okay, let's talk about what is going on right now. There's an election palaver. There's so much going on at work. There's so much going on with our lives individually, our work and all that. There's pandemic, right? Which of course, we're not talking about pandemic anyways, but of course, I just want to be specific and just put everything into perspective as to what could actually be leading to stress. So if an individual is actually going through stress, how does an individual actually know he or she's actually going through stress? Okay, so if you can, help, maybe explain on that aspect.
Like I said, it's first of all, the feeling of stress is somewhat subjective. However, I would say that for a person each person definitely would know their normal self and their normal states. And then it's a matter of being attentive to yourself and knowing that you're feeling out of sorts, uneasy persistently, or you have an high intensity of either a feeling, either in your mind or in your body, because a lot of times, it manifests as either for some people, either tiredness, headache, anxiety, palpitations. So it's a matter of just knowing when your body is acting or manifesting things that it doesn't usually do, and it's doing that persistently or in very high intensity over a short period of time.
Okay. So like those three things which you mentioned now could be the symptom of stress, right? So it means your body perhaps is actually, reacting to something which you obviously feel in your own body that this is not normal, right? Perhaps those are the kind of symptoms and all that. So how then did you, manage those stress? And at what point do you either raise an alarm or, to either your doctor or any kind of healthcare professional around you to say, well, I'm going through this XYZ and all that. I don't really know what's going on. So is this something which an individual can actually manage on their own, or they need to perhaps seek, a proper healthcare consultation?
It actually, depending on the manifestation that a person is having, one, and obviously what the triggers are, would require maybe something that you need to take care of by yourself or seek, expert help depending on what's going on. And identifying, once you identify that something is wrong with me, I'm having this persistent headache. Again, I cannot overemphasize how this is actually very personal, and it just requires personal attentiveness to oneself. For me personally, for instance, like when I have a headache is not something I usually get. I wonder, like, okay, why am I having a headache? And I try to figure out what has happened over the course of the last few hours or in the day. And then I figure out what has happened, or maybe something has been persistently happening the past couple of days. And then I'm telling myself, okay, I need to make changes, or I need to add something more relaxing or something more calming if it's a stress you can't avoid. For instance, if you have an exam and you really need to study, you can't say, well, I'm going to come back on my study hours.
Yeah.
It would now be, okay, I really need to study, but what else can I do to help me feel relaxed, more relaxed in the time? So do you want to go for a quick massage? Do you want to take a nice shower? Do you want to take a walk? Or rather than spending the time you're not studying, chatting or watching TV, do I want to sleep an extra hour and things like that? So some of these things are things that you can manage on your own, or does someone want to say, okay, you know what? I know we have a deadline at work. Maybe we have this project that's coming up, but I'm going to take 10 minutes to meditate, just to focus on my breathing before I go to work, or in between on my lunch break, I'm going to take a walk. Some of these things help. Sometimes it's as simple as getting a massage can help, and it doesn't even have to be a whole body massage. For people who are into I can't remember the word they call them, but for people who are into things like massage and muscle therapy, kinesiology,
kind of thing,
yes, they know some pinpoints. I have a friend who she would just hold your hand and massage your hand, and you would feel that relaxation all over your body. So sometimes it's as easy as a temple rub, it's as easy as a foot massage or a hand massage. And a lot of times things really get bad, where if you're having like psychological manifestation where maybe you're having a lot of palpitations, you really can't sleep, you might need to see a psychologist, a therapist, to be able to talk through, because a lot of times some people cannot even figure out what the stress is, and it takes narrating your experience to somebody else,
right,
and then they help you peel apart what is going on. Like, okay, have you considered that this may be this? Because sometimes you're so wrapped up in everything that you can't see, and some people can't. And there are times where the manifestation of the stress may be something that requires medical attention. So someone might say, oh, I've been working a lot, I'm having this headache, or my heart is beating fast, and I can't, there's nothing I'm doing that's helping it. And then you get to the doctor and they tell you your blood pressure is through the roof. Obviously, at that point, they could say, are you able to slow down? Can we try lifestyle modifications? But honestly, if your blood pressure is not controlled, you're still going to be having those. So you might need to be placed on medication, or you really cannot sleep. Getting sleep aid is not necessarily advisable for like long term, but for a short period of time, you might just need something to help you break that cycle. Because stress itself and its manifestation is actually a vicious cycle, where it's funny how, the thing that starts it, just once it starts, sometimes it's just difficult to break that cycle where things just keep going on and on and on, and it takes a major intervention like medication, or just to be able to break the cycle.
Right. So, okay. So can stress lead to depression?
Yes.
Okay. So in that case, so what is depression? What is stress? Like in the context of what you've just explained now, because the reason I'm asking that question, I'm asking that follow-up question for listeners out there who perhaps sometimes, kind of misconcept or kind of mix it up. They probably are not able to figure out what the exact stress they're going through, and thinking, well, maybe it's actually not even the stress they're going through, and maybe they don't even have any stress. Maybe it's just depression or something. It could have been something else. So I just wanted you to speak to that demographic of people who perhaps are actually struggling between, stress and depression. Perhaps so at the end of the day, they're able to probably understand, well, this is actually, is either interlinked, or actually stress can probably even lead to depression.
Yeah. So remember in the beginning, we said that stress is basically your body, the feeling of stress is your body reacting to things that are overpowering it or making it work too much. And of course, stress itself as a thing or as a phenomenon is something that's putting pressure on your systems, physical, biological, psychological, emotional, right?
Yeah.
So you have something we call a stressor, an event, an encounter or incident that is either one time or repeated. And then you have the feeling and the effect on the body, and then you have subsequent outcomes. Now, the way stress can manifest in some people is anxiety, where depending on the cause, right? So for someone who is in a high-performing job, for someone who has an exam, for someone who works a lot of hours, they are tired all the time. They feel very tired, but they really cannot stop. It's that you have that anxiety, and sometimes anxiety is basically where you are heightened awareness, and anxiety sometimes when you cannot rein it in, when you cannot tell yourself, okay, I got this, I can do this. Like for instance, someone who is saying, oh, I have this deadline at work, or I have this deadline at school, and you're hyperventilating, like, oh my God, I can't do it. I don't think I can do it. If I do it, I'm going to do it wrong. I'm going to make a mistake. I'm going to fail. That leads to, because it's like you cannot. And then you get to a point where you're just like, okay, I think I'm just a failure. I think I'm going to, I think I'm a failure. So it leads to a point, there's a threshold a person gets to where it kind of leads to hopelessness. And it's funny because I remember probably a couple of years ago, I'm a doctor, but I would see people, they'll be like anxiety and depression. And in my head, I'm like, how can you have anxiety and depression together? Naively, till I actually experienced it. You know, wow. I was about to graduate, and I was thinking of my possible career options for personal and family reasons.
Right.
And I was thinking about exploring a path that was not necessary, that was not traditional. Because as a doctor, you know, you graduate from your clinic. Yes. You're supposed to go and get a clinical job where you're working.
Yes.
And I was looking for something different. And I was looking at all the job requirements, and they were like 5 years of clinical management. I was like, how do I explain to these people that I've been managing residents, I've been managing, you know, medical students for like 5 years, but it's not in this field. And I was just hyper and extra, and I was crying like, oh my God, all this education I have, all this work experience I have, it's not preparing me for any other thing other than this traditional path of medicine. And I just overwhelmed myself. I got overwhelmed with that feeling of, I can't do this, I can't do that, I can't go into this field. And I just had a moment where I just felt sad. It was just like I was extra in 1 minute, and the next minute I felt sad, and I was like, why am I feeling sad? Right. And for me personally, I have a strong self-reflective trait. So when I'm feeling something, I query it and I analyze it. So I was like, why? And I realized it's because I feel like there's nothing I can do about this thing. So it took me to a point of hopelessness. And that's where the depression sets in, because so now you're anxious about all the things you want, but you can't get, all the things you want, but you can't do, or you don't have the opportunity and avenue to. And then you cross that threshold of hopelessness where, well, I'm not going to be successful. Well, I'm not going to make money. Well, exactly. And once you get to that point and you now sit in that, and that now becomes, so now you're no longer anxious about I can't. It's just it's now a resignation of I cannot. And even though there's still a part of you that's yearning, that would really like for that thing, there's a bigger part of you that has accepted it. So you want it, but you know, I can't get it, so I'm just gonna feel sad. Well, not that I'm going to feel sad because it's not a choice, but it's something that's happening, and you sit in that. So that's one way that stress can lead to depression. Other way is just looking at the biochemical part of it, is depending on the type of stress you're having again, your body is they call it maladjustment. Your body is secreting different types of hormones. There's the hypothalamic pituitary pathway. And all of these hormones, there's you're secreting things like cortisol, you're secreting things like adrenaline, and different levels of these hormones, they move in different ways. For instance, in adrenaline, the pathway, there's dopamine. Dopamine, works in some ways in the brain. And dopamine is also, the hormone that has something to do with Parkinson's and things like that. So because your hormonal system is also out of sorts, it's not normal, it changes the biochemical pattern of your brain.
Of the brain. And then it messes up.
Yes, and then it just changes everything. So the way you would not react normally to a regular trigger, you would react in a different way. And your body also, so you are reacting to something in a way that you shouldn't react normally. You're probably eliciting a different response, and your body takes it in again. And everything is just, once there is one comma, everything just leads to a big error.
Another thing leads to something else. Okay.
Yes. Okay. So it cascades.
So can you help me explain this feeling? When you're having a feeling of being trapped in your home as a result of stress, what do you do?
What do I do, or what should somebody do?
No, what should somebody do? So I'm asking that question so that, you've said a lot of things, right? And of course, like, just like you said, like, there is hormonal imbalance, and everybody has the different body system, and the way it reacts differently. You see, so and I'm asking that question because I know, and I'm very sure that we have a whole lot of people out there, whether young or old. This is very, very important, message or topic, which needs to probably, showcase some sense of awareness and as to how they can actually link some, one or two things to, to unravel whatever stress they're actually going through. You see, so that's I'm asking that question, like, if someone is having, a feeling of being trapped in themselves, how then, as a result of stress, how do they manage that?
Multiple ways, obviously.
Okay.
But so, for instance, for someone who for some people, different things work for different people. For some people, it's just about being able to physically relax. For some people, it's about being able to take a break. So if it's your work, take a break. Sometimes there are people, especially in America, in the United States, there's a high percentage of people who do not use their paid time off.
Absolutely. Oh, a lot.
because there is kind of like a vacation shaming thing that goes on, where you take a vacation and people are looking at you like, of course, and then employers or whoever it is, managers try to guilt people into feeling like you are dispensable, like, oh yeah, you come back and they've given your task to somebody else, and because a lot of things are linked to employment, a lot of people are living paycheck to paycheck, people have mortgages, your health insurance is linked to it. It kind of makes that job kind of like a lifeline for a lot of people, which has shown. But I think one is we need to normalize taking breaks, daily breaks, weekly breaks, monthly breaks, annual vacations, daily breaks. Like, yes, 8 hours. Why don't you look, not just a lunch break, for instance? And I can tell you, doctors are really bad at this. In terms of, we don't take breaks.
They just go on and on and on and
we just power through. A lot of times we are eating, even our lunch break is not a lunch break. You are eating lunch as a resident, and we're eating lunch and you are getting a lecture during that lunch break.
Wow.
Or as an attending now, I'm eating lunch and I'm eating lunch at my desk. I'm eating lunch and I'm typing a note. I'm eating lunch, but now, I try my best, like, okay, today I'm going to try to finish early, or I'm going to finish this amount of work. Right. I will take a walk, or I will go and sit down. I think it was 2 days ago. Where I discovered a garden, because I was just overwhelmed, with all this Nigerian stuff. And I was just telling myself, like, I just need to go outside. I just need to go out, because I was actually having palpitations. I was just like, I just need to go outside. And as I was walking, I looked to the right and I saw this garden, this place, and I just went there and I sat down. And I sat down there for like 30-45 minutes and I felt much better. So taking a break in between the day, during the day, is something, even if it's 15 minutes, just sit down.
Right.
Don't talk to anybody, just sit down and breathe. In that moment, have a moment where you don't owe anything to anyone, you don't owe anything. And I try to do that for myself. Right. Let's normalize taking our vacations. There's nothing wrong with going to a spa. Don't feel guilty. Do something for yourself that helps you recharge, that helps you feel relaxed. That's one.
Right. Okay.
Obviously, there are some stressors that are kind of like insidious. They happen. It's not overwhelming in a short period of time, but it's persistent. It's persistent and it's there. Those are the ones that, okay, that every day you're going to go to this work and this manager is going to give you a lot of work and you take it.
Right.
But there are some stressors where, for instance, like I gave the example of, I'm trying to search for a job and I'm looking at the job. And in that moment, or those kind of moments where you have an exam, you have a deliverable at work, for me, what I started doing, and I learned it also, I saw it, that kind of phenomenon used also in multiple areas. I was in my class, strategic development, It's basically pausing and saying and asking why. Okay, so why am I stressed out? Because I feel like I don't have the qualifications for this job.
Job?
But then shift the conversation. What qualifications do I have? Right? Focus I remember in that class, they called it focus on the bright spots.
On the bright spots.
Is look at what you have, first of all, because you might just be reading it in the way it is. Because again, a lot of these resume things is about packaging.
Absolutely.
How do you narrate? How do you state what you've done? You see someone who literally all they do mostly at work is get coffee for their bosses, but they will present it in such a way that you're like, oh my God, you're a great executive assistant, right? So it's about, what do I have? So I try to shift the conversation to, what do I have? What have I done? What is my track record?
Correct.
How can I pivot? Okay, even if what I have is completely unrelated to what I want, no problem. How can I get to that point? And then I now make a plan. In my email, I have this phrase where I put beginning with the end in mind. So I look at where do I want to go, and I start making a plan. How do I get to that point? What do I need to get to that point? And sometimes, it's, I'm going to school and I need $20,000 for my tuition. Okay, you don't have the $20,000 now, but why don't you make a plan?
Right.
Don't just dismiss it like I can never get to that school. Okay, that school needs you to write or a personal statement. Write your personal statement.
Right.
Then look at, okay, how can if I start saving up for the school? What if I save up $2,000 or $1,000 every month? Not everybody can afford that. Right. But it's about making what are the possibilities, and then you make a plan and you break it down. Of course, the plan again can be big and overwhelming, but you break it down into tiny steps that you take.
Absolutely.
But really, it's a lot of it is in the mind. It's about like figuring out why you're stressed out. And going because sometimes some people be like, oh, I'm traveling, or I'm going to this place alone. I don't know anybody, or my friend is traveling, my mom is leaving me. And you're like, okay, but has somebody left you before in the past? Yes. Did you die? No. Okay. Where they are going, can you call them? Yes.
Right.
Okay. Why don't you try and call them? It's about like figuring out what are the alternatives.
Right.
It might be easier said than done, but it's something that once you start it and you do it over and over, it becomes second nature.
Absolutely.
So there's multiple ways to cope with stress. First, it's about figuring out what the stressor is, figuring out what works for you. A lot of these things is about self-discovery, is knowing who you are, what works for you. Two people can experience the same stressors and manifest differently. They can even manifest in the same way, but what gives them relief is going to be different. Right. So each person has to understand themselves. A massage might work for somebody, a walk will work. There are some people who tell you they are stressed and they go and run. Me, tell me to go and run. Why? Please, I don't want all that. Like, I would rather just sit. I just like the outside. I call it the outside.
Let me absolutely.
Let me just sit down and have a period where I owe nothing to nobody.
Right.
That is the best. Yes, that is the best thing that works for me personally. Is nobody can, as in this period though, except I'm the one that will save your life. And that life, I can see my name written on it, which is not possible. So, yeah.
And honestly, you just nailed it earlier, because the truth is all about beginning with the end in mind. And again, I just add to that. It's not just beginning with the end in mind, but also, like, one has to also feed your focus and, just starve your distractions. I mean, honestly, for me, I will cite myself as an example. Like, it's been a remote work since it's been maybe 7 months or going to 8 months now.
Yeah.
So I know that at every point in time, of course, there's an emotional part, there's a health part, there's so many other things which you get overwhelmed, you get phone calls right and left, back and forth, emails, you need to respond to these, you need to respond to that. The truth is, all of those things are kind of overwhelming, and it can actually, of course, stress you out. So what did I do? I wanted to tell me if I'm actually on the right path as to what I just came up with. I came up with this thing. So I called it routine. So aside from my task for my 9 to 5 every day of the week, I came up with an additional routine and that additional routine, I align it to me working from home, because I call the work from home my personal workspace. And I need to make it work for me. See, I put behind me, the notion of that I am working in the physical office. Working in the physical office, you might not even have time to actually even get up to want to go for a break or anything. Mm-hmm. But for me, the routine is, the truth is, I won't lie to you. Sometimes one of my routine, I get on the PS4 video game, I play soccer. It will be my lunch break, and I'm not sitting down on the computer from morning till whatever hour I close for the day. No way. I take a walk. I move around. I change my workspace to make it easier, because I know that, hey, if I sit down in one position, and again, even go like the body system, when you sit down, you realize that I don't know, like the blood doesn't flow very well, and then it's like start to swell up or something like that. It means you're not moving around. You need to move. So that is what I have done. Am I on track?
That's fine. Like I said, again, is what works for you. Just like you have said, taking a walk, making sure you get up and walk is very relaxing and helps you to cope well.
Right.
For me, I can be in my house for 3 days straight and not touch my front door, and I am perfectly fine. So again, it really is about like knowing what works for you and just and getting it. So absolutely. That if that works, yes, because blood flow is also good. Being active enough to move blood around, that's something that has been shown to help.
And I know that study has also shown that some folks actually go the yoga way or the yoga route to actually release stress and all that. Mm-hmm. And, I think yoga is something which is organic, and which is actually, pretty much synonymous with Asians, especially Indians, right? Mm-hmm. But is this something which is also, medically accepted, or what's the how do I call it? So what's
the medical
acceptability and in actually that
yoga? So it's a relaxation technique,
correct?
And so it helps relieve stress,
right?
So as long as it's someone being able to just relax, and the process of relaxation, obviously, again, even though it's physical, you're doing something physical, but it actually has a biochemical effect. Because because that process of focusing, it lowers your blood pressure, it lowers your heart rate, and the lowering of your heart rate really just doesn't happen by itself. Again, it's the chemicals that are released by your body. So doing that persistently, your body gets in the habit of feeling relaxed.
Right.
So yes, there's benefits of yoga that, there's some studies that have shown some benefits where they're like, somebody, putting people on through different stressors and more different types of relaxation techniques. And some studies have shown that yoga does have some benefits in people on some health issues,
right, okay,
or health conditions.
Okay. So I also want to ask this, and again, the reason I'm asking it is actually for listeners who fall within the category of maybe like senior citizens, maybe like 40 upward and all that. So like of course, sometimes when some people actually take medication for some any type of thing, going on with them. There's always this period, or there's always a point in time when you just get tired of taking that medication. Taking the medication stresses you out. But the thing is, you need to take that medication. So I need you to actually talk about that, in the sense that, how does that person? No, it's true. Honestly, it's true. See, this is going to be very informative and educating for whoever finds ourselves in that kind of position or state of the mind. So, and it's also going to be researching, evidence, for that kind of person as well. So, see, medication is a different thing to actually. Sorry. Medication, is a step to actually solving, a certain health issue. Okay. Now, it's another different ball game to get tired and be overwhelmed as a result of that medication one is actually taking, which obviously I still call it stress. You're just stressed, just tired, like, I'm tired of taking this medication, da. So how does one manage that? How does one actually, try to just stay calm and say, look, just take this medication, da. Or, I mean, what do you recommend? What's your recommendation? I just want to, hear, and of course, for those listeners out there also probably get to learn something out of that as well.
So it's actually a phenomenon, right? There's something called pill. We call something pill burden, but that usually is used to refer to people who take a large number of medications. So there are people who are on like 5 pills, 6 pills, 12 pills, and they're tired.
Yeah.
But of course, there are people who take 1 or maybe just 2 medicines and they get tired of taking it.
Correct.
Honestly, it's something that kind of just needs, how would I put it? Almost like psychotherapy. Okay. And I think it's basically would require the person just understanding the condition and understanding that to have a healthy outlook, so to staying healthy, this is needed. Right? So right. It's about, I would say, for someone, I would probably try to help the person focus on the benefits. I understand it's stressful. So for instance, you go to work. Honestly, I'm sure if they asked like 90% of people, they say, get the same amount of money and sit at home, or we pay you 25% of that, of what you get at work, and you don't work. There are people who would accept it because they're like, I don't want to work. I'm tired. I just don't want to do anything, or I want to do less. Right? It's the same way where you now tell people, you make someone understand that. So you want to buy a new car, right? And so it means that you have to work, or you have to pull an extra shift. The same way you wake up every day and you go to work to be able to pay your bills.
Right.
You show up, even though you're like, yeah, I could be doing something better, or I want to do something else, but you still get up and show up. So taking your medication is showing up for your health.
Showing up for your health.
It's showing up, and I take care of HIV patients, and one of my attendings taught me this, like, you tell your patients, like, you take this pill every day. On a good day, on a bad day, on a rainy day, on a sunny day, on an anxious day, make it a constant. It's easier said than done, because especially, people who are relatively young and they kind of feel strapped. Like, I can't live my life because, no, you can't not live your life because you're taking a medicine. You have to try to find a way to fit it in to your lifestyle. So it's trying not to look at it as this thing that's a burden, but rather look at the medication as a facilitator, as something that facilitates healthy lifestyle for you. as something that adds value to your life. Because guess what? If you don't take that medicine, you're diabetic, you don't take your medicines, you don't do the things you're supposed to do, well, give yourself a couple of years, you're talking about nerve pain, and then you will be begging for the medicine, right? You're talking about wounds that won't heal, and God forbid they have to cut off your leg, or you're talking about blood. So it's about understanding. And sometimes, a lot of times, people actually don't even understand the conditions that they have and the impact of non-compliance. So taking the medicine is not easy. I am not going to lie to you. I had my own physical. My last physical was somewhere earlier this year. And my doctor was like, oh, your cholesterol, you know, Nigerians and plantain. More like dodo.
Yeah.
And she was like, yeah, so your cholesterol. I was like, I'm not taking a medicine. We're going to work on that lifestyle. We'll cut down the oil. And I went home and I was like, after a week or two, I'm like, oh shit. I have a new, the next time I'm giving a patient education on lifestyle changes, like I'm going to put some respect on that, because now I know that it's not easy. It is not easy at all. Making those changes, doing those things, it's not easy. But you have to look at it like, what do I want? I want to be able to get up and run. I want to not feel tired when I climb a flight of stairs. I want to not feel like my heart is literally going to burst out of my chest when I climb to the second floor, right? I want to be able to sleep and not feel like my body is going to fall apart, or whatever it is that you're feeling.
Right.
And then it's like, this is what I need to do to get to that point. It's about creating a positive goal for yourself and just working towards it. And that's, I mean, like I said, different things will work for different people. Which pretty much
actually, you know, explains everything. So at the end of the day, you just have to see it as a motivating factor that will help harness, you know, a healthy physical, you know, system for you or your body and all that. And don't see it as a body. But again, you know, see, I grew up understanding this. And I'm going to ask you this question. Well, I wouldn't say it's a myth. It's not a myth, really. But I want to believe maybe it happens or it doesn't happen. And I think I've not really done like too much research on that. But again, so some say that taking too much medication could actually destroy the lungs. Is that true? Is it true or false? That's number one. Now, let me now put it this way. What is the Dr. Malake? I'll tell you, see, a lot of people have different things happening. Trust me. So now let me now put it like this in the second question follow-up is that is there a kind of is there an impact or a side effect of taking too many medication, which is you take it as prescribed, you're not taking overdose or anything, you're taking it as prescribed? Is there any kind of side effect that, you know, impacts any other organ of your body system, e.g. lungs?
So, okay, where do I start answering this from? First of all, there is, except the medicine you are taking has been shown to cause lung damage.
Okay.
I don't think that it would be right to say that taking too much medication causes lung disease. Nope. That's not true.
That's false.
That's not true. Now, in fact, if anybody wants to even say something gets damaged, maybe you even talk about too much medication damages your liver, too much medication damages your kidneys. I could say, okay, that needs a little more explanation. But the lungs, because, and I use the liver and the kidney as the point, because those are actually the two main organs that detoxify, that excrete, that remove medicines and the byproducts. Yeah,
correct.
Of medicine from the body.
Absolutely.
So obviously, yes, there are some medicines that you're taking them for a long. For instance, in fact, let me even say this because
Be
our
specific.
people.
Yeah, be specific.
For instance,
Thank you.
taking ibuprofen, Advil. I think ibuprofen is Advil. Ibuprofen, naproxen. What's this thing that these people use for arthritis? Diclofenac. In Nigeria, they will say Felvin. Indomethacin. They use it for they tell you they are using it for romanticism. But basically, like some of these, NSAIDs that they use for arthritis.
Right.
NSAIDs. Taking too much NSAIDs can cause kidney problem. That as in it's a side effect, because there's a way it works that it basically, too much of it or taking it for too long narrows the blood vessels that go to the kidneys. So it's basically like choking your kidneys for a long time, right? So that's one. And there's a bunch of other things. But again, it's about whatever medication you are taking. Of course, there are some idiosyncratic reactions.
Correct.
And there are some rare reactions.
Right.
But everybody has this right. And please, one, I feel disappointed when, I'm talking to people and they're like, they said this is what is going on. What did they give you? I don't know. They should have said that. Or they should have just gave this medication. And I'm just like, this is your health. This is something that if anything goes wrong like this, your life may be on the line and you don't know what they're telling you. So please, people who are listening, please, you have a right. It is your body, it is your health, and you should know about these things. If your doctor is not explaining well, you tell them, please, I need you to explain. Again, if the person, because again, we're different with our skill of explaining things to people. There are doctors who will explain things to people, and I'm looking like you're explaining it like you're talking to a medical person.
Correct.
So, but tell them to give you, if you cannot understand if they cannot say it in a way you can really understand, tell them to give you pamphlets, educational material.
To break it down for you to understand.
Because they are standardized educational materials and information packets that break it down into lay English. Of course, there's Google. Don't go and, I wouldn't say don't go and Google your symptoms, but if they give you a diagnosis, you can go and Google. If they tell you your cholesterol is high, you can go and Google, because these things can educate yourself. Then find a professional if you have a friend, a family friend, and you want to talk to somebody who can explain it to you.
Absolutely.
So we should be conversant with our diagnosis, whatever it is, whatever medications we are taking, understand the side effects and the effects of the medicine, and also interactions, especially for people who take a lot of medicines. There are some medicines that cross-react. One medicine can make another medicine work too much. One medicine can make another medicine work too little.
Medicine.
Yes. Because even us, like, that's why, electronic it will flag it like, oh, this patient is on a blood thinner and you want to give them this thing. It's going to make it, your body is going to excrete it too fast, which means all those kind of things. So it really is about understanding what you're taking and how your body reacts to it. Because again, you can give twins the same medicine and their body will just
it's just like something I learned in my clinical research class about when you want to have a trial on a subject, so you need to like make sure you double check on if they're actually taking some type of medication. If they're pregnant, or like they really need to just speak up on whatever it is medication they're taking, so that whoever is actually going to start the trial on them will know what to do and all that. And
even supplements and herbs.
Thank you. I was going to ask that. Those are the two questions I was going to ask before.
They are very, very. They are very, very important. Supplements and herbs also make a whole lot of difference.
Cool. Okay.
For instance, there's this. Is it a root or a tree? It's called St. John's Wort. And St. John's Wort, And some people use it for depression, they would use it for all sorts, but it actually has interaction with some other medicines, right? So that's one. There's some other things where, people will say they are using ginkgo biloba, people would say they are using all sorts of things. So tell your doctor if you are using any supplements. I will give you an example. Sometimes it's not even interacting. Again, it's just not experimentation. When I was doing my residency, there was this nurse, chatting and everything, and we're talking about hair and skin, and she was like, oh, that she uses high dose vitamin B6, and she's been using it for years, and her hair and her nails have been growing. I said, let me to go and try it now. Why not? And I started using it.
Oh wow. And then
I was fine. And then I started having really bad acne. Painful. When I say painful. And I didn't know what was happening. And I kept using it. It was like, because when you take a normal multivitamin capsule, maybe the vitamin B6 that's in there is maybe like 100 microgram or something. I was using like 3,000 microgram.
Oh, wow.
One day, the God that I serve, that wanted to save me from the calamity I put myself inside, I stumbled on some YouTube video, beauty YouTube video. I don't even know how I got there. I stumbled on it, and she was like, yes, something about if you're taking care of your skin, something does. I just know what you're taking, something supplement, like vitamin D, that vitamin B6. Don't take too much of it because in some people it can cause acne because it does something. And I was just like, Subhanallah, Lazim. In fact, I still have the remaining vitamin B6 in my house. I'm sure it has expired. I just stopped it. I was like, wow. So imagine I was taking a supplement. Thank God I wasn't taking some other medication. Some other person, right. It could have, he had a visible negative reaction on me. So imagine if I didn't stumble on that, I will go to a doctor. They will give me one medicine. They'll give me this. They'll give me that. Meanwhile, the underlying problem is I was causing an imbalance.
Imbalance, correct.
Because I was using too much of something.
Right. So in a nutshell, so in as much as supplements is actually really good for the body, but it is not, should I say, it is not all the supplement that is actually, okay for everyone due to reaction or whatever of the body system. Is that what it is?
I think I would say excessive. Because what I was using like 1,000%.
Okay.
Is what excessive. I was using. So I think
excessive consumption of supplements, can actually cause some other kind of reactions to the body system.
Yes.
So it means one has to just take as little as possible. You don't have to take too much.
Yep.
Okay. So, but supplement is very good for the body. Yeah. Please, you were going to finish off something. What you were saying?
Yeah. So it's basically it's just about and people who take agbo.
Okay, organic. But I mean, I always agbo. They don't. You just see. It doesn't have those.
I would not say a blanket no to it.
Right.
But I wouldn't also strongly suggest it. I mean, I'm a doctor, obviously.
Oh yeah.
But I also know that there's a place for unprocessed botanics. That's what I would use it.
Correct.
Because natural formulations of things, it's like saying ewe dogoyaro that they use for malaria in back home.
Yeah.
I believe that God created these things, and there's a natural formulation of it that there's something in that leaf more than just that quinine that balances it out.
Absolutely.
However, there are also some mixture. Or buying,
all those things,
and all those things where they are not putting all sorts in, and at that point I really cannot say. But there's some that you can easily say, this and this, because I remember someone was telling me, a family friend, that there's someone in Nigeria, the person studied botany and kind of runs like a shop, a botanical, herb shop or something like that. And the person is able to help you formulate based on what you need. I haven't been there, but for me personally, I think I was, even though I'm a doctor, I still see myself as a naturopath, where for whatever it is that I need to take care of, what is the most natural way first of all?
Possible, right?
I look at what's the most natural thing I can do before I now start looking at medications.
Right.
Even though I'm a doctor, but I'm not saying don't go to your doctor. I still
correct. So Dr. Falake, so before we come to an end of this show, what message do you have for those who are, perhaps struggling with stress and not being able to figure it out, and those who are taking medication? I know you've said a lot of things and all, just like kind of a last motivational message, just for them to know, okay, look, you have to do this and all
that. Stress.
Yes.
I think I would just, first is like, you're not alone. Everybody goes through it. It's not normal, but everybody has some form of stress. And I think it's good to find your people that, you can talk things through with. Someone who, the moment they hear your voice, they know that something is wrong and you're able to let it out. Right. Find what it is that are your stressors. Do your best possible to remove them or minimize them. Right. Figure out how you can do that. And there are some things that unfortunately is difficult. Like if you live in Lagos and you live in Ajangbade and you're working in VI, and you cannot afford to rent house in VI. Or obviously, you may not even be able to afford to rent house in Surulere or Ebute Metta, right?
Absolutely.
And somehow you shall have to sit in that 3-hour traffic. Look for what are the ways, what are the other things you can do to balance it out. So that traffic, when you're sitting in that traffic, do you want to listen to like relaxing sounds? Do you want to see, okay, let me save a little more money rather than entering bus that will sit on Paco? Maybe I should enter a smaller car that has better cushioned seats, because sometimes it's just this little thing. So even if you cannot remove the stressors, how do you now strike? How do you balance out in terms of doing things that help you relax? And I think that's what I would say for stressing. And people really should pay attention to their health, because chronic stress, it causes a lot of problems. It's not just about, oh, I'm not feeling well, or I'm feeling tense, or I'm having a headache. It actually has long-term effects on people. Heart disease, hypertension. In Africa, we talk about people having low birth weight. In America, they talk about Black women having low birth weight. And a lot of it, there are studies that have linked chronic stress to these kind of things, preterm labor, small babies, things like that. So please pay attention to your health. Please do your wellness checks. Wellness check is usually 100% covered by insurance for those who live in the US. Please do your wellness checks. At the very, very least, do your wellness check. And don't say, oh, well, it's when I go to the doctor, they will now find some things. Better they find it when it's going to cost you $20 to fix than when they find something that will cost you $2,000 or $20,000 to fix. So please, let's pay attention to our health. And what was the other thing you asked for? In terms of people using medication. Yeah,
medication, yes.
Honestly, just put a positive spin on it. Like I said, see it as the key to a better life. See it as the key as a key or a vehicle to that goal that you want to, that, hey, I can go on a vacation if I don't have a stroke, and this thing is going to prevent me from having a stroke, right? I can go on a vacation, or I can relax when I'm not feeling this or I'm not feeling that. So that's what I would say.
Thank you so much, Dr. Falake, for your time and attention. Honestly, this has been very, very interesting, conversation about health, because the truth is health is wealth. If you're not healthy, we're just They're just like miles and miles and miles away from, from being wealthy, So again, thank you so much for coming on the show, and I really, really, really do appreciate you, for taking out your time. And I trust me, I'm gonna bring you back on the show for subsequent episodes, on health and wellness. Because the truth is, health and wellness is very, very broad. So there's a whole bunch of different things and all that. So thank you so much. And listeners out there, you have heard Dr. Falake what she had said. Please and please and please, just pay attention to yourself. Manage your stress as much as you can. If need be, if you know you're not in control, seek or call, your doctor. And for medication, just always make sure that you make sure that your medication, whatever medication you're taking, it's a vehicle to actually, helping you to become healthy. Thank you so much again, and I hope to bring you back on the show next time. Thank you so much.
Thank you for having me, and have a great day. Bye. Bye-bye. Assalamu alaikum.
Wa alaikum salam. You have just listened to the Reconnecting the Dots podcast with your host, Abdurrahman. Don't forget to subscribe to our podcast on iTunes or Google Play. And thank you for listening, and see you all next week. Bye-bye.